Good afternoon. My name is Dr. Tony Lang. I'm one of the past presidents of the Movement Disorder Society. We're here in San Diego for the 19th Congress of the Movement Disorder Society, now the International Parkinson and Movement Disorder Society. And we're celebrating the 25th anniversary of the society this year as well. It's my privilege and pleasure to be interviewing a long-standing colleague and friend of mine, Dr. Andres Lozano, a neurosurgeon from Toronto, and we're here to conduct an oral history for the Movement Disorder Society and recognize Dr. Lozano's important contributions in the field. So, welcome, Andres.
What a pleasure to be here with you.
Well, I'm really looking forward to this. And so, as is usually the case with these interviews, we start from the beginning. So, I'd kind of like you to tell the viewers about your early career, where you were born, how you got started, and what brought you to your early academic decisions about neurosurgery and neuroscience.
Right, well, my family is from Spain, and I was born in Sevilla, and when I was 3, we crossed the Atlantic and landed in Ottawa, the capital of Canada. And from there, grew up and went to medical school. And it was really during medical school that I got turned on to neuroscience. And I decided when I was a teenager that I was going to be a neurosurgeon. So I decided very early, and for me, life...
You were corrupted that early
in life?
Yes,
life is very straightforward. I mean, you just decide what you want, and then you just follow the path, and you end up where you want to go.
So what made you think of neurosurgery at that early stage?
I remember just the awe and complexity of the brain, and I felt it was like this understandable, this vast universe that was there, which was complex. I thought it was the most challenging thing anyone could ever go into. I remember seeing a film of Dr. Penfield, a very famous Canadian neurosurgeon, when I was about 14 or 15, mapping the brain, stimulating the surface of the brain. And I said, that looks pretty cool, stimulating the brain. Maybe I should do that too. And so that was really one of the important events in my life after seeing that and deciding really that, the brain is the most interesting thing I can think of. This is what I want to devote my career to.
And a functional neurosurgeon too, so that even at that early stage, you were thinking.
I was thinking I was perplexed by how the brain works and how you can unlock the secrets of the brain. And so that even then I thought, this sounds like the most exciting thing anyone could ever do. And so it was a straightforward decision for me.
So let's take it from your teenage eureka experience with Penfield to your early neurosurgical days. And tell us a little bit about some of the obstacles you faced and maybe the role models that got you to where you are now.
So I decided I went to medical school in Ottawa, and I decided the best place to do neurosurgery was to go to the place where Penfield was. So I decided I would go to McGill and to the Montreal Neurological Institute to learn about brain mapping and how the brain works. I thought that was the best place in the world to go to. And in addition, I was also very interested in doing research and doing novel therapies in the brain. And about the time when I was a resident, the whole era of brain transplantation in the context of Parkinson's came through. So you remember the Madrasso work, which was published, and that was really the most exciting thing at that time, back in the mid '80s, where you could actually, seemingly have a huge impact in Parkinson's disease by transplanting cells. We've since learned that maybe it's more complex than that.
Just a little
more complex. But I thought, let's try to understand how the brain works. Let's try to use science to develop novel therapies for the brain. And so I worked with Albert Aguayo, so he was my PhD supervisor, and it was basically in the theme of transplantation in the brain. And so I got my PhD by transplanting pieces of peripheral nerves into the brain and showing that, in fact, axons could grow into these peripheral nerves and so on. So that was really the theme of my early education to gain experience and background both in science and in neurosurgery. And then I felt, I could be let loose on the world, but of course I needed more training. And one of the very important experiences in my life has been to be able to go to Queen's Square and work with David Marsden. So it turns out that at McGill they let us out for 3 months to do an elective. You could go anywhere in the world, and I decided I would work with Professor Marsden at Queen's Square. And that was really a tremendous experience to be able to work with the master. It was really a treasure trove of neurology, every most complex disorder you could think of, and to be in the presence of such a great intellect. So that was another very important formative experience for me.
It also explains how good you are at neurology, too. I've seen you in action and at grand rounds and things like that. You pick up the neurology sometimes faster than the neurologists themselves, so that explains a lot of it. So Aguayo, Marsden, any other important mentors that got you?
I think the other mentors have been my colleagues in Toronto, both on the neurology and neurosurgery side. So Professor Tasker was my mentor in Toronto, my predecessor, and he is a pioneer in functional neurosurgery and in mapping various areas of the brain. And he, together with Jonathan Dostrovsky, who was a physiologist, we really together have been able to continue this work, working as a team, and been able to go to areas of the brain that no one has ever been to before, and we've been able to characterize the attributes of neurons in these areas of the brain. So it's a tremendous experience. You feel almost like Christopher Columbus landing in the New World and meeting these people, and for the first time hearing what they have to say and hearing their language. And so you can go to these various areas of the brain and you can record from these neurons, and they're revealing their secrets to us, and sometimes for the first time that anyone's ever been there. So it's been a tremendous experience to be able to work with our colleagues in Toronto. And of course, there's been our tremendous collaboration over many years, which has been terrific and a highlight. And I think one of the reasons why we've had some measure of success in Toronto is because we've been able to bring forth multiple disciplines and people from different disciplines working together towards accomplishing things that none of us could do by ourselves.
Well, like you, I have enjoyed that collaboration, and it really has been a remarkable opportunity to take advantage of strengths in so many different fields. And you landing with Dostrovsky and Tasker, I think, must have been really exciting to begin to take their techniques beyond what they had been doing. And so let's hit you right between the nose or between the eyes and ask you, what do you think your most important contributions to the field and accomplishments have been?
Well, I'd like to think myself as someone who is pushing the frontier. I like to go to areas that haven't been explored. I like to do things that people haven't done. I'm not a Me Too kind of person. I like to do new things. So I like to. I think our contributions have been really twofold. One is to describe, to map various brain areas and describe the neurophysiologic attributes of various areas of the brain. For example, we were the first to describe the neurophysiology of the STN, the neurons in the human STN in Parkinson's disease, and the pedunculopontine nucleus, and other areas of the brain. So really to be an explorer and to examine the attributes of neurons in the brain and travel through the brain and discover these new areas in the brain. And secondly has been probably the examination of novel therapies for Parkinson's disease and other disorders. And so an example might be I remember when we first were asked to treat a young boy from Israel, and not knowing exactly what to do, what to go, but really having a certain degree of audacity and going into these areas of the brain, not knowing if you're doing the right thing, not knowing if what you do will work, but that has been sort of the spirit of surgeons. I think surgeons have this attitude of not always being right, but never being in doubt, and going to these areas and doing things because we have a tremendous bias for action, for doing things. So I think that's one way where perhaps neurologists and neurosurgeons are different, where I think neurologists are much more careful and think very carefully. We tend not to think so much and tend to be have a biased reaction. And once in a while it turns out to be right.
We should just finish that story for the listener, because I learned a great deal, both about the disease and its treatment, but about the difference between neurologists and neurosurgeons. You remember in the operating room this very unfortunate young boy with DYT1 dystonia, terrible generalized dystonia. His only way of getting from one point of the room to the other was to crawl around on the ground. And because of the severity of the dystonia, he was done under sort of a general anesthesia, but he had to be woken to see what the results were. And so you did the one-side pallidotomy, and he was woken, and we saw absolutely nothing. The dystonia was just as bad as when he had gone to sleep. Right. And so we put him to sleep again, and you and I argued, and I said, well, you haven't seen anything. We obviously need to get more of the outflow. I think maybe we should do the thalamus on that same side. And you said, nope, I'm doing the other side of the pallidum. You're going to do the contralateral pallidum.
Let's do one side, you see nothing. What are we waiting for? Let's do the other side.
Do the other side. And we went back and forth. I couldn't believe it, but you were the boss. It's your operating room. And you did the opposite side. We woke the child up. And again, we saw absolutely nothing. At least he wasn't worse. Right. But unfortunately, we saw nothing. But then, as many people know from having seen the videotapes of this very famous young boy, over the next couple of days, he began to show improvement. And in the weeks to come, he nearly normalized. He, as a long saga that I hope will be told, because he subsequently relapsed and he's had deep brain stimulation. And I think our team has learned a great deal in managing this young man, yourself and Ellen Amoro working together to help him and his family. So carry on.
So those are really doing new things. We took on the PPN, as you know, gait and balance disturbances, freezing are huge problems for our patients, and trying to understand where to go in the brain, what can be done in these patients, trying to go back to the literature, going back and trying to discover, is there any possible place that you can stimulate in the brain, and having some. These are complex problems. There's no roadmap. There's no instruction manual that comes with these operations. So you really have to create this investigation on your own. You have to really try and try to be systematic, try to be scientific, try to collect as much data from imaging, from intraoperative imaging, from intraoperative physiology, from stimulation, to try to build a case that it's justified to go to these new targets. And so over the course of the years, I've been very fortunate to be involved in these novel therapies, and then some other ones. For example, been involved in counseling for gene therapy for Parkinson's disease, and putting in retinal pigment epithelial cells, and now we're doing other things like spinal cord stimulation trials for Parkinson's, and even focused ultrasound. So we have, I feel like we are drinking from a fire hose. I think there's so much to do. There's so much opportunity, and we're fortunate that we have the environment, we have great patients, we have great colleagues, that we can actually take on some of these problems.
What do you see as the greatest challenges, scientific challenges, to your career development and the things you've been doing?
Well, I think one of the issues is that you have so many ideas and so many things you want to get done, and there's only so much time. And you sort of have to pick what you're going to do, because it's like going to the candy store, and you can't possibly eat all these candies. You have to choose which one, and having the discipline to decide which ones, having a systematic approach and betting on the right things is a tremendous challenge. So it's a question of focusing, and part of it has to do with who your colleagues are, and how much help you can get from them, how much expertise, how much are they actually contributing to the science, to advancing, to questioning, versus how passive they are. So we've had some tremendous experience in movement disorders. In other fields, it's been less fruitful, and it has to do with the strength of the entire team. So it's not just one individual, but you realize that you really need the entire team to make progress, and everyone has to be on the lookout for any clue that gives you a hint, any foot that you can get in the door. So that has been, there's been some areas that have been more successful than others. I think in movement disorders it's been one. In the psychiatric field, perhaps less so. And now we're taking on even new things. We're even working on Alzheimer's disease and stimulation with Alzheimer's. So with the tremendous success in DBS for Parkinson's, then the idea of applying DBS to other circuits and to other illnesses is now possible. And indeed, we have a current trial of DBS for Alzheimer's.
So with the betting analogy, what are you betting on? Where do you think this field is going to go in the next 5, 10 years? What are the big changes that we're going to see?
That's a difficult question. It's hard to predict, especially when it concerns the future, as Yogi Berra said. And I think that the challenges that I see in Parkinson's disease are the non-motor symptoms. I think we're pretty good at treating the major motor manifestations with either drugs or existing therapies, but really the non-motor manifestations, we're seeing that these are really the main drivers of disease burden in our patients now. Now that we've gotten better and better at treating their motor problems, now the cognitive problems, the balance problems, the speech problems, these are I think the most important thing. So getting a better understanding of the pathophysiology of these disorders and coming up with novel strategies to help our patients is something. And it's always you always wonder whether we're going to need to place more than one electrode in each hemisphere. One electrode for the motor component and perhaps one for cognitive components and one. So really, I think Archimedes said, give me a fulcrum and I can move the world. So it's tempting to say, as functional neurosurgeons, give me enough electrodes and I can fix most problems. So we know that's probably not going to be the case. But it's clear that there's not one sweet spot in the brain that can treat all the problems of our patients with Parkinson's disease. And as these other problems, these non-motor problems, become much more prominent in our patients, we're going to have to come up with some new approaches for those.
So as we are all doing now, you're dealing with young trainees, young physicians, young neuroscientists that are beginning to get interested in this field. What do you tell them in terms of what to do, how to get them as excited as you've been to do what they're doing?
Well, I really tell them three things. One is that curiosity rules the day. I mean, they have to, everything they see, they have to question. Every patient they see that they are stuck and they don't know what to do, this is an opportunity to ask a new question. Every patient they can't seem to help is a new opportunity. Whenever you run into a roadblock, that to me is an opportunity when you have someone that you've not been able to help. So I think that remain extremely curious. Question everything. Is this really the best way of doing things? And there's a lot of dogma, and a very good way of becoming famous is to break dogma. It used to be said that you can't operate on the STN. That was dogma, right? So you have to break dogma if you want to make progress. So that's one thing is remain curious. Second is perseverance. I mean, it takes a huge amount of energy and effort to overcome all the barriers that you need to do new things. There's regulatory issues.
Increasing barriers.
There's funding issues. There's all kinds of resistance to almost anything you do, and you have to have the tenacity of purpose, and you have to be a bulldog if you want to get things done. If you give up, it's more things have not progressed because people have given up than because they weren't good ideas, right? So I think perseverance is a hugely important attribute. And the third thing is surround yourself with great people. So you have to work in a milieu where you have great colleagues, or you can interact, where you can bounce ideas, or you can get input, feedback. So I think those are the three pieces of advice that I would give to a young trainee.
Excellent. 20 years, rolling the clock back. Anything you'd do differently?
Well, I think I would sort of answer what Churchill said. He said, that time in Monte Carlo, I should have put it on the black. Basically, no. I mean, I've been very fortunate to be able to choose a path for my career. and to be able to follow it in a relatively straightforward manner with not too many twists and turns. So I feel that there's nothing to change either in my personal life or my professional life. I've been very fortunate.
I think that's probably the case for most people that come to the point of being interviewed at this kind of table. I think you're there because of the dedication and what you've given it and how much you've really enjoyed it and been turned on by what you've done. You have to dedicate an awful lot of time and effort to do that. This has become a very important issue for young trainees, the work-life balance. Tell us how you manage that.
Well, I decided not to get married until I was finished my training. It was because I thought I was so dedicated and devoted to that I felt there was no room for anything else in my career at that point. Then I gave in, and I was so fortunate to marry a wonderful woman. And in fact, I love neurologists so much that I married one. So my
She's
wife,
a good neurologist.
my wife's a neurologist, and so I think probably 95% of your happiness is who you marry. So that's a very important thing. There's no question that we work very hard, and that we're off balance in our lives. Our professional lives take up so much of our time. That's a true thing. But despite that, I think I've been able to have a great family life and a great life outside of work, and finding that balance is a secret, but it's a very important one, and I think determines how your overall level of happiness and success.
Now, you mentioned the tenacity you need, the bulldog kind of approach. Can you think of some major obstacles and challenges that you've had to overcome in getting to where you are now?
I think that it is more of
just don't mention me.
Yeah,
okay?
it's more of the Byzantine process to get things done, where fill out this form, go to this room, and then they tell you to go back to the room, and then they tell you to go back. So there's this constant noise that you have to overcome. And basically, you have to be able to say that's enough, and you just have to get things done. So you're only able to tolerate so much of that before you say no. This has to be done this way. And I think that if the nature of your goal is sound and your conviction is high, that then you can overcome many of these barriers. And so you really have to have good ideas, and you have to be really committed to them, and then you can weather these inconveniences that are as minor barriers that are just there to overcome.
Sticking with the young colleagues and mentorship and what you tell them, the barriers that our up-and-coming neurologists and neurosurgeons are facing, do you think they're greater? Do you think that the obstacles are harder to surmount?
I don't know if it's always very difficult to know whether they have a more difficult time than we do. I think that the culture in general and lifestyles are becoming more important in culture. I think that access to information is so much better now with the internet. I had to go to Index Medicus in the library and go through every week. I used to do that, and so there's been tremendous advances in the last 20 years. I think that the expectation of having a better life balance now by individuals is a real one. And you wonder what impact, if anything, whether they'll be better because of it. There'll be better doctors, better scientists because of it, or not. It's something that time will tell.
So we started this interview mentioning it's the 19th annual Congress and the 25th anniversary of this incredible International Parkinson and Movement Disorder Society. I think it'd be nice to hear your perspective on the role that the society has played in our field.
Well, the society has been very important. I think it has really, this is a relatively new field, the movement disorder field, in its current form, and it's really had tremendous growth. It's been a sounding board for the entire discipline. I think that the journal is really a forum for us. We used to have the movement disorder meetings every 2 years, or now every year, because of the tremendous amount of activity. So the society really has a tremendous role in convening people and bringing them together. I think it's also had a major role in education through the courses that we hold, through the meetings that are organized, the educational meetings as well. And also in research, we've had several examples where the society has convened very specific efforts in the research realm, whether it be the development of instruments, tools, rating scales, or to convene people with special interests to take a problem that faces our field and to move it forward. So I think that we are very fortunate to have this society, and I think it's made a major impact in the entire field, and I think that has translated into much better therapies for our patients.
Agree entirely. The other aspect that I'm very impressed with, and increasingly so now, is their role in trying to get junior people interested in the field, nurturing their enthusiasm, their leadership skills and possibilities. So I think it really has been a wonderful 25 years. You got your last word. Any final points you'd like to bring up in this
Well,
discussion?
I think that it's always with mixed feelings that you embark on these types of interviews, because it probably means that you're over the hill.
That's right.
So I hope that there's still a little bit of runway left, but it's been an absolute pleasure to be part of this society for these years, and it's been a tremendous honor and pleasure for me to work with you and our team in Toronto.